Hi, this is Dr. Paul Reifenrath for Upper Level Canine. I'm a veterinarian that has 35 years of clinical experience in small animal medicine and surgery. Today we're going to talk about spay and neuter considerations and some of the new recommendations. When's the best time to spay and neuter your pet? Do we really even need to spay and neuter our pet? So these are some of the questions we're going to explore. So over the last 40 years or so, we've been telling clients to spay and neuter at a very early age, sometimes 4 to 6 months of age. This was mainly due to the pet overpopulation that was occurring over the years and our desire to limit pet overpopulation. So recently, over the last probably 5 to 10 years or so, we've been changing those recommendations. So now we're recommending, especially for our large breed dogs, we're recommending waiting till after a year of age to spay and neuter. And even later for some of our giant breed dogs, sometimes up to 1.5 years to 2 years of age for our giant breed dogs. Our small and medium-sized breeds, we still are recommending probably between 6 and 12 months of age. So we'll get into the details as far as why we want to do that as far as the spay and neutering at a little later age. So we're learning that reproductive hormones are a lot more important than we originally thought. They're very important to signal normal musculoskeletal growth, for behavioral development in our young animals, for immune system development in our young animals, and also for reproductive function. So let's discuss some of the advantages and disadvantages of neutering. So with the advantages of neutering, and neutering and spaying, I'll just say neutering because it's basically the same thing. The advantages, the biggest one is going to be population control and limiting and eliminating unwanted pregnancies. So that was our main goal with that, and that's still a very high priority in this situation. So we can also limit some unwanted behaviors in our dogs, and things like marking behavior, urine marking territory, mounting behavior, interdog aggression, and also roaming behavior in our males and females. We also eliminate the female heat cycles. So usually a female is going to come into heat anywhere from 6 to 12 months of age. There's going to be a seasonal influence with that. Typically decreasing or increasing day length will bring a young dog into their first heat cycle. So a lot of times spring and fall, we're going to see that happen. So we can also prevent several different cancers. And with females, the biggest ones are going to be ovarian and uterine cancers. They're rare, but they do happen. But probably the biggest one is mammary cancer. So we can limit the risk of mammary cancer depending on when they're spayed. The more heat cycles they go through, their risk will increase over time. Initially, we wanted dogs to be spayed before their first heat cycle to virtually eliminate that risk of mammary cancer. But we are finding that if they go through 1 or 2 heat cycles, that risk is still minimal as far as developing mammary cancer later in life. With the males, we eliminate the possibility of testicular cancer. Not common, but it does happen. We tend to see it more often in dogs that are what we call cryptorchid, and that's where one of the testes is retained up into the abdomen and hasn't descended down into the scrotum. So those undescended testicles tend to have a very high risk of testicular cancer. So those dogs, it's really important to neuter them before this ever becomes a problem. So the other thing is preventing pyometra in females. Pyometra is a uterine infection. Usually that will occur after their heat cycle. Usually it's going to be in our middle-aged and older dogs. And symptoms with pyometra include having vaginal discharge, usually kind of foul-smelling vaginal discharge. We can also have situations where the cervix is closed and they don't have any vaginal discharge, but they become very, very ill. So they're going to be drinking a lot of water, urinating frequently in large amounts, and usually running a high fever, not eating, vomiting, just feeling really awful. And these are really serious infections. And Typically, the treatment course for a pyometra is to have an emergency spay. And these can be very, very involved surgeries to go through. So another thing we can prevent with spaying and neutering before that happens. So in males, we can prevent benign prostatic hyperplasia, which is enlargement of the prostate due to testosterone influence over time. And this can influence their ability to urinate, also the ability to defecate if they have a very large prostate. It can also lead to prostatic infections. So neutering is very effective at preventing that. And usually it's a treatment measure if we do see those problems develop. So the disadvantages of neutering. So one that we see fairly commonly in females is urinary incontinence. And this happens due to the lack of estrogen in the body after we spay them. When that happens, the muscle at the neck of the bladder loses its tone, especially when the dogs are sleeping or resting heavily. And they will urinate without their knowledge during sleep. So they'll wake up with a puddle behind them. And that can be a really significant problem for the owner, depending on where the dog's sleeping, of course. So it is something that we can manage with a couple different medications. So it does occur in about 10 to 15% of our spayed females. Large breed dogs tend to be a little bit more prone to this. So there's also an increased risk of joint disease in dogs that have been neutered early. Reproductive hormones are really important to signal the cessation or the stopping of bone growth during normal growth stages of maturation. So when we spay and neuter before their bone growth is done, in 4 to 6 months of age, and even large breed dogs up to 7 to 8 months of age, we tend to have these dogs grow longer and for longer than what they were originally genetically programmed for. So they can become taller, and that can also increase the risk of certain joint diseases such as cranial cruciate ligament disease, hip dysplasia, and elbow dysplasia. We'll talk more about those orthopedic diseases in a future video. So there's also an increased risk of non-reproductive cancers. This can be breed and gender specific. So some of the common ones that we see that are influenced with neutering, mast cell tumors. This is a type of skin cancer that we see in dogs, and it can vary in severity from basically benign growths to very severe life-threatening cancers. So our typical breeds that we see associated with this are boxers, our Vizslas, our Labrador retrievers, golden retrievers. Very common, typically need surgery to be dealt with, and there are some medications and chemotherapy that is necessary to treat them as well. So another one is lymphoma. Lymphoma is a lymphoid cancer. And this one most associated with our golden retrievers, especially female golden retrievers. So it can be very serious disease to treat, and without treatment, typically it is fatal. So another one is osteosarcoma or bone cancer. Bone cancer usually occurs in our large and giant breed dogs, so our Rottweilers, our Irish Wolfhounds, our Great Danes. This is a very serious type of cancer and can be fatal. Typically will metastasize quickly to the lungs and is extraordinarily painful for the dog to go through. Probably the most painful thing that a dog can experience. So another one that we see increasingly now is one called hemangiosarcoma. And this is a tumor of blood vessel origin. It occurs most commonly in the spleen, also can occur in the base of the heart. This one typically metastasizes or spreads early to the liver, usually before diagnosis. So this one has a very poor prognosis when it develops. Sometimes if we catch it early, it can be treated surgically. But if it occurs around the base of the heart, there's really nothing we can do, and there's no chemotherapy that will help that. So these dogs are at risk of, the biggest problem is rupturing of the tumor and them bleeding out into their abdomen or into their chest. That is a very serious, life-threatening problem. So those are the cancers that we see associated with early spay and neutering. Some of the other things that we can see some immune related disorders, increased risk for those. So atopic dermatitis, something that we discussed in a previous video. These are environmental allergies. Another one is immune-mediated hemolytic anemia. This is where the immune system targets the red blood cells and usually has a very poor survival rate with tremendous expense to try to save these dogs. Another one is hypoadrenal corticism, and this is where the immune system attacks certain layers of the adrenal gland and leaves them without certain hormones that are necessary for normal metabolic function. And another one is hypothyroidism. That's where the immune system attacks the thyroid gland and has the ability to decrease the amount of thyroid hormone, which is necessary for metabolism as well. So things to consider. Also, we do see some behavioral problems that can be associated with neutering. So probably the biggest ones we see are fear and fear aggression, as well as generalized anxiety disorder. Probably the biggest problem that we have to experience with dogs that have been spayed and neutered is obesity. So once the dog is spayed and neutered, their metabolic rate can plummet significantly, especially with our females. We do need to decrease their calorie intake. We want to maintain their exercise routines in order to eliminate or prevent that excessive weight gain. Obesity causes so many problems down the road, from joint disease to other metabolic disease. So it's something that we want to try to avoid. So probably the biggest thing that we have seen is we spay and neuter a dog at a young age. They're still on their puppy food, and we see them the following year, and they've gained 20, 30 pounds because they're still on puppy food, which has got a lot of calories in it. So around spay and neutering, if they're still on puppy food, get them off puppy food, get them on an adult diet. So, and that'll decrease and probably feed them quite a bit less too, depending on the breed. But also it's important to maintain their exercise. So that's always a very important situation. So some of the other general considerations with spaying and neutering, always discuss this with your veterinarian at the time of their puppy visits. So that's what the puppy visit is for, to discuss future health care. And that's a great time to discuss these situations. When's the best time to neuter? Should I neuter my pet? My general philosophy with that should we neuter our pet? If we have a dog that is responsibly cared for and is not going to contribute to unwanted pregnancies, and the dog doesn't show any excessive hormonal symptoms, a lot of times these dogs don't need to be neutered. But we do see some dogs that it is a big problem. So probably the biggest thing with that is with females, with their heat cycle. And that can be a significant issue for a lot of homeowners. They don't want to deal with their female's heat cycle. So we have about a 7 to 10 day period at the beginning of the heat cycle where they're bleeding. And for about 3-week time period, they're going to be attractive to any intact male within a 10-mile radius. There's going to be an increased risk of roaming, looking for those males. So those are some of the risks that we see with allowing a female to remain intact. The other thing we talked about previously is it's important to delay the spay and neutering for our large breed dogs. So we want to wait till at least a year for our large breed dogs, later for our giant breed dogs. So with the female heat cycle as well, some of the dogs, their first heat cycle can be very, very mild. So they can also go through what we call a silent heat, where they don't show any outward signs of their heat cycle. The only one that would know would be a male dog. We also see some females go through what we call false pregnancy. And this is where they're under the influence of progesterone later in their heat cycle, after they've gone through their estrogen phase of the heat cycle. And they will start to show some maternal behavior. So they'll be mothering a stuffed toy. They'll be building nests around the house. They may even lactate, but they're not pregnant. So something to consider. The other thing is, if your female is in heat and she's scheduled for her surgery while she's in heat, her surgery is going to be delayed. So what we recommend is waiting a couple weeks if she's in heat, mainly because during their heat cycle, their estrogen levels are high, and estrogen will impact the ability of blood clotting And with our elective surgeries, we just don't want the risk of having excessive bleeding. So it's best to wait a couple weeks to get their spay done if they're in their actual heat cycle. Some other considerations with delaying neutering till a later time. Usually with our young dogs, our young puppies, spaying and neutering is a relatively simple surgical procedure for the dog to go through, and they heal amazingly fast. So with our intact males, even our older male dogs, neutering is still a relatively simple procedure to do. But with our older dogs, there is an increased healing time and usually some increased pain management because it's a little bit more involved surgery. So with our older females, especially our large breed females, this can be a really complicated surgery to go through, especially if they're obese. If they're obese, it's an incredibly complicated surgery to do. And that increases the risk of increased exercise restriction after surgery, increased pain management, increased risk of hemorrhage. So it's a big deal, as well as increased costs involved with surgical and anesthetic time and pain management. And we did talk about pyometra in our older females, so this also can be an extraordinarily involved surgery. We have a very ill patient that needs emergency surgery. Some of these dogs can be deathly ill, and they require some extended care and hospitalization after surgery. So this can be a very expensive situation for the dog to go through, and so it's something that we can address by usually spaying before they become middle age. So we do occasionally get requests to spay and neuter, a male or female that has become aggressive towards humans. This rarely helps resolve the problem. So it can help with interdog aggression, but rarely does it help with aggression directed at humans. One final consideration, contrary to popular belief in the hunting circles, spay and neutering does not influence a dog's ability or desire to hunt in our hunting breeds. So what usually influences their ability and desire to hunt is if they develop obesity after they've had their surgery. So usually these dogs can develop some joint pain and usually are really poorly athletically conditioned to go through their hunt if they're obese. And as far as removing the hormones associated with the ovaries and the testes, that does not influence their desire or ability to hunt. So work with your veterinarian and determining the best time to spay and neuter your dog, and if the dog needs to be spayed or neutered, work out what's best for you and your dog. So not every dog needs to be neutered, especially if they're responsibly cared for and in prevention of unwanted pregnancies. If you have any questions, please talk to your veterinarian. We deal with this all the time, and things are evolving with this situation, so there'll probably be new recommendations somewhere down the road, but these are the most current recommendations for our large breed pets especially. So thank you.